Hi friends, thank you for tuning in to the Concussion Coach podcast. I'm Bethany Lewis, the Concussion Coach. I'm a neurological occupational therapist and certified life coach, and I specialize in guiding people through their concussion recovery journey. I am passionate about helping people understand their injury, speed up their recovery, and reclaim control over their life post-concussion. The purpose of this podcast is to help increase awareness of concussions and the impact they can have on a person's life, and to bring hope to people who have suffered a concussion and those who love them. I firmly believe that sharing stories and knowledge about concussions will bring important light and understanding to this misunderstood and often invisible injury. The information in this podcast is meant to bring that awareness and hope and is not meant as medical advice. The opinions shared are those of the interviewees and my own. If you are suffering with lingering concussion symptoms, I have created a concussion coaching program specifically for you. I will be your mentor to guide you through your recovery journey, offering help with understanding and managing your symptoms, setting achievable goals, and learning how to manage your own thoughts and nervous system in order to get control over your life again. If this program sounds like something that would help you or someone you love, sign up for a free consultation. In the consultation, you'll get valuable information and resources and gain hope for your future. Sign up for your free consultation at the link in the show notes or at my website, www.theconcussioncoach.com. Hi friends, welcome back to the Concussion Coach podcast. Before I introduce my guest today, I just wanted to make sure that you all know about the free guide that is available on my website. It's the 5 best ways to support your loved one dealing with a concussion. If you have a friend or a family member who is struggling with post-concussion symptoms, or if you're the one struggling and would like your loved ones to know more about what you're going through and how they can help, head over to my website, theconcussioncoach.com, and download the free guide. I'm so excited for this conversation today. My guest is Jason Kreuzman. Jason is a pediatrics occupational therapist based out of St. Louis, Missouri. Is that St. Louis or St. Louis? That's like terrible that I don't know. St. Louis, thank you.
You can call it whatever you want to.
Okay, perfect. All right, St. Louis, Missouri, that specializes in the treatment of pediatric functional neurological disorder, FND, and chronic pain. He is the co-chair of the FND Society Pediatric Committee and chair of the St. Louis Children's Hospital Multidisciplinary FND Committee. Jason is the founder of Rewire OT, which includes an outpatient clinic set to open December 2025 and an FND-focused resource website. Through the FND Society, Jason is currently leading the project to create pediatric FND occupational and physical therapy treatment consensus recommendations. So this is fantastic. I'm really excited actually to learn more about this and hear about your story. So thank you so much for being here with us today.
Thank you for having me here. I'm excited.
Yeah, absolutely. It's going to be a good convo. Okay, so usually I like to have my guests just start off right away by sharing more about themselves, but I think with this topic, it might be helpful to give our listeners a basic definition of what the heck functional neurological disorder is off the bat, and then we can hear more about your path to helping people with it. So let's start with that definition that you tell your clients or their parents, since you work with pediatrics. So yeah, what is the basic? What is it? And then we'll dive into the details later.
The basic of what FND is it is a dysfunction of the nervous system that is perpetuated by a difficulty between the brain and the body communicating with each other. So whether it's caused by a physical trauma, emotional trauma, illness, virus, any of these kind of things, life change can elicit this miscommunication within the nervous system that elicits these physical symptoms. It used to be called conversion disorder. And now is functional neurological disorder. And the big differentiation is that there are positive signs that we get to this diagnosis. Whereas before we thought that it was emotions that were manifesting into physical symptoms. We now know that that is not the case.
Okay, interesting. And it still seems fairly broad and vague. Is it one of those like umbrella terms? Like it's kind of like you exclude other things, and if we can't figure it out, then this is what it is? Or am I off?
It is an umbrella term, but it's actually a rule-in diagnosis. So we have positive signs. We utilize different tests to prove our assumption that it is FND. So it may show up that these tests are quote unquote negative, but that negative appearance within an MRI or an X-ray or EEG really is just proving that it is this functional neurological disorder. And so it can be things like functional limb weakness, sensory changes, functional seizures, to name a few of the different symptoms.
Okay, fascinating. Okay, yes, we'll dive into more of that. Thank you so much. So tell us about, when I get to talk to OTs, I love hearing their path to OT. So how did you get into occupational therapy? And then specifically, how did you get into working with children with FND?
So how I got into occupational therapy, I actually thought that I wanted to be a physical therapist. And my college counselor told me that I was more of an OT. So initially I was really offended and I was like, I don't know what's that supposed to mean? And then I did more research and kind of looked into it and did a lot of like respite care and observed different clinics and thought, how cool is it to utilize our daily occupations to help with rehabilitation and recovery? And then I've always been intrigued with like engagement with pediatric or young, like youth populations, just because of one, like their awe of when they're learning new things is fascinating, but also um, we can teach them things for the first time, or we can utilize play and be silly and those sort of things. So talking in different voices and playing games is a way that we can kind of incorporate progress. I thought that was kind of a fun thing, like how cool to get paid to play games. Not too bad.
Right.
So yeah, so that kind of pointed me towards occupational therapy. And then while going through school and into my first job, my first job was at a pain program at the Children's Hospital of Philadelphia. And I had not been exposed to amplified musculoskeletal pain or complex regional pain syndrome or these different diagnoses. And so that was what I actually started seeing, and learned pretty quickly that there was a lot of crossover between that and FND. And often these patients had FND that just was not diagnosed. So I've worked at a few different pediatric hospitals and been able to collaborate with some really passionate physical therapists initially, that were working on resources and programming for FND. And I was super curious about like, what is this thing that I was never told about? And quickly realizing that it is actually not as uncommon as we think it is. Like it's more common than we think. And that it presents just like neurological trauma that we would see from like a concussion or a TBI or things like that. And I thought how fascinating that is. And as I did more research, I learned that there's not a lot of resources and there's not a lot of providers that are treating this. And I've always been kind of a sucker to help the people that are not being helped. So on top of being fascinated by this, seeing like an immense need, and then working in pediatrics where there's even less resources,
I'm
I just
sure.
kind of jumped in headfirst with a couple physical therapy colleagues.
I love it. That's so awesome. And yeah, I'm so fascinated by a lot of these things that the I I guess since I haven't worked a ton, it's funny. I actually got into occupational therapy, interested in it because of the pediatrics population as well. I was like, that was my introduction. I was like, oh, you're getting paid to play with kids and you're helping them develop. Like this is the best thing
Yeah,
ever. But then most of my career has been with adults, and now adults and teens in this realm here. But chronic pain with kids is like heartbreaking to me. Just the fact like that is even a thing. Like little ones having to suffer that. You always think of that as like an older adult thing,
yeah.
chronic pain and even this FND, I would imagine. But yeah, that's really interesting that there are little ones dealing with that and that the crossover a lot. So when was it that you became aware of it? Did you say it was when you were at the in Philadelphia?
So I was less aware when I was in Philadelphia. I ended up moving down to Dallas Children's Hospital, and that's where I learned initially about FND. I was actually working in a different pediatric hospital before it transitioned to that, and we had been working on creating pain programs and saw these patients come in that presented differently than what we would normally see for like these different chronic pain diagnoses, and their recovery looked different. And we noticed that different approaches like collaborating with psychology and these other therapies was more beneficial.
Mhm.
And so that kind of sparked our interest to sort of do some research and look into it. And that's where I came across like the FND Society, and they had these international conferences that had only recently just started. I mean, I think they're on the fifth one now, and they do it every 2 years, so pretty new from a society standpoint.
Yeah.
Um, so yeah, just kind of dove into that and um, helped fill the need, if you will.
Yeah, that's fantastic. So and I know we're gonna again dive into the FND thing more,
Yeah.
but you mentioned to me outside of this that you have recently been dealing with your own experience of concussion, which I'm so sorry about that, but also I'm sure it will inform our discussion here. So how are FND and concussions
similar? Like now that you've had this experience and you've done a lot of research on FND, like tell me what this has been like for you and yeah, what is it like? How are they similar?
Yeah, it's interesting. So I have had concussion in the past, but more recently, like one in June. And so just going through like the symptoms of that, having the dizziness, having it was more sound sensitivity than light sensitivity. But I think the fact that it seemed more of like an invisible kind of diagnosis to where like from the outside, people just will see me and think everything was fine, right? But I believe I went back to work maybe a week after, and I would squat down to play with a kid and I would stand up and the room would be spinning. And I'm like, that's not safe. So I had to go have conversations about that. But I think that that's where some of the similarities between concussions and FND come in. Often it's kind of seen as an invisible diagnosis. I mean, sometimes, a lot of times, there's a lot of these external symptoms that we see, so like functional gait or functional limb weakness that makes it hard for us to move around. But this hypersensitivity to our environment, to extra physical activity, to like changes in like social engagement and those sort of things that always impact our symptoms or exacerbate them, I think are pretty similar with FND and concussion.
Yes. And how about the on the impact on life and occupation specifically? What do you see as similarities between those?
I think they're impacting our occupations almost identically, really. Like, I mean, the symptoms are present differently. There may be more like physical outward symptoms for like our FND as opposed to concussion. But both are impacting our like levels of fatigue. Both are impacting our pain as it pertains to like migraines or headaches or these comorbid symptoms that come along with our diagnosis. And in turn, making it hard for us to do our daily occupations, to stick with routines, to return back to school or work and do it in a way that is sustainable. Often we see these like ebb and flow in symptoms. So there could be days that are good and there can be days that are not great. And there can be moments within the day that kind of go back and forth, which I think, at least for me with my concussion, was very similar. I'd have moments where I felt great. And so I'd have this sort of like, not like imposter syndrome, but like this feeling of like, I'm fine. I should just get back to what I'm doing. And not having FND, I can imagine that there's moments that are kind of like that, where we feel that we're doing okay, so we can do a lot more, and then maybe we end up paying for it afterwards. And so instead of us
Yes.
being able to do things a couple of days in a row, we do something like really adventurous and fun, and then we're down and out for a day or two. I
Yes.
think there's a lot of similarities between the two for that.
Yes, absolutely. And I do, yes, that exact experience I think is something that a lot of people can relate to. Like, oh, I'm doing okay now. And then just also questioning themselves, like when you're doing okay, it's like, oh, well, did I just make all that up? Like, was I really as bad as I thought that I was? Like that questioning of, am I crazy or lazy all of a sudden? Like, I think
Yeah.
a legitimate question that people ask themselves. So I appreciate you bringing that out because you're not abnormal if that is what you're experiencing.
Yeah. Well, I
Yeah.
think especially in pediatrics, then you add in the complexity of the family unit and co-regulation. And not
Yes.
only is the young adult or youth patient having these symptoms and difficulties, but then their caregivers or family have to either be able to see them or understand that there's that ebb and flow that
Mm.
adds extra stressors to it and maybe extra pressures.
Yeah, I can totally see that being the case for like extra stress and pressures on everybody. Like the caregivers being like, "What the heck? You could do this yesterday. Why? Like, are you just making this up? Are you like, is this just a behavior thing?" Yeah. Oh man, that does. I hadn't even like really thought about that, but that really complicates everything. It's hard enough as an adult trying to figure those things out, but if you're a
Right.
kid and you don't know, and then you're as an adult caregiver, you're like, I don't know what's happening here. Um, why don't we get a little bit more details about FND specifically? So you gave us a broad overview. Can you like can you help us understand um, how people get it? You mentioned a couple things, but like how does it happen? What ages can it come about? Like is it an injury or is it a like something that they're born with? So many questions.
So many questions.
Yeah.
To start with, like ages, at least from a research standpoint, I think the youngest that has been documented was like 5, and then the oldest is like 95. But I would say that the typical would be like late adolescent and then into adulthood.
Okay.
So like after puberty is probably more of that time. And so I think the factors that lead to FND like onset are not fully known, but we do know that there are biological, psychological, and social factors which impact all other diagnoses. But I think those are some of the things that lead to onset of FND. I think there's a misconception that there has to be a stressor or there has to be some sort of like triggering event that happened and then led to this FND, but not necessarily. And it could be subtle things. Like we could have like a viral infection that really just throws your nervous system out of whack. And as a protective mechanism, our nervous system is overworking and sending information based off of not good data, if you will. And so it's sort of fighting itself. And so that's where therapy comes in to kind of help normalize our nervous system, help with improving function, and then progressing those symptoms. But I think there's a variety of different things that onset. And unfortunately, we don't have these tests or blood work that we can do to like say, there it is, that's FND. So I think that that's one of the things that makes it harder as well. They see these changes in like functional MRIs where they can note changes in like amygdala functioning and things like that, but that's hard to do when you go and get initial assessment. People don't just readily have functional MRIs sitting around.
Right. Well, and how would people know if that was something that they should even look into? What are the symptoms what does it look like?
Yeah. So more often than not, we would have people either going to like a primary care physician or a general practitioner or to the emergency department because they have these quick, sudden onset of symptoms, not all too different from like a stroke or something like that, where you would have this like functional weakness where maybe you're not able to stand up and you can't put weight on your legs, or you can't lift your legs to be able to move, or you have a pretty consistent tremor in your limbs, or you have cognitive changes or ability to speak are impaired. We see a lot, at least at my hospital. I can't speak to like the global what is seen like trends wise, but we see a lot of these functional seizures that present the same as an epileptic seizure. But when they hook them up to an EEG, it doesn't show any abnormal activity. So the brain waves are completely normal.
What?
It's wild, right? So that's those kids, they have these seizures. They come into the emergency department and they are either hooked up to EEG or find out through history or like their occupational assessments, often with neurology, to determine that these are not epileptic. And there's actually like positive signs like asynchronous movements, hip thrustings, different eye movements, duration that can differentiate it from epileptic seizures, which is pretty wild. And that's where the confusion comes in, is that you have this thing that is not because of a trauma or a like injury, but because of our nervous system not operating appropriately, sort of trying to protect itself, but kind of going the opposite and being like hyperactive. So the symptoms can range significantly.
This is like blowing my mind a little bit here. And you talked about chronic pain being sometimes associated with it. How often is pain a major part of this?
Pain and fatigue are probably the most common comorbid diagnosis with FND, whether it's something that kind of was there at the onset, or when we have these like functional like limb like tremors or weakness, it's going to change the way that our body moves. And so just like anything else, like even if we had like an ortho injury, you're going to have referred pain elsewhere because you've modified sort of your movements and how you're functioning. Often we see this a lot in variations of FND as well.
Okay, I have like so many questions, but I'm gonna try to stick to this. I have to like pick your brain again later. But how do you help kiddos who are dealing with this? And it sounds like they're not usually young kids. It's teenagers and older.
More often than not, yeah. More often than not, it's teenagers and into adulthood. Yeah.
And all right, just really quick.
Yeah.
Are there any similarities between people or like as far as like family life, family support, like on that more psychosocial side of things? Are there things that are indicators that someone's more at risk, or is the
It's,
family profile just different for everybody? It totally depends on.
I would say it totally depends. It's probably different for everybody.
Okay.
I think that the like psychosocial factors significantly impact perpetuation and can be a factor with like the onset of our FND symptoms. But it's hard to tell that like you came from X family background in this geographical area, you're more predisposed to have FND. I don't know if there is the data out for that, or if there is, I'm not aware of it.
Okay. Oh,
But
man.
yeah, that would be fascinating to learn more about that.
Yeah. Yeah.
Um,
Okay. Well, this is it is really, really interesting. And especially the functional seizures, that's really blowing my mind. Like they're literally having a seizure. It looks like a seizure, but their brain isn't doing what typical epileptic seizures do. Like what's happening in the brain for those. Uh,
right.
okay. Okay, man. So how do you, okay, sorry, I'm like so thrown off by all of this. It's so fascinating and heartbreaking at the same time. What do you see as OT's role for rehab? Like how do you, is recovery possible? Like can you recover, and I don't even know, like recover fully? I know with brain
Yeah,
injury, like you're never not going to have had the brain injury. Like that's going to be in your system, in your body forever, but you can really make massive changes and like recovery. It can look like recovery in a lot of ways, although there may be some things that you're always need to be a little bit careful of or whatever, right?
sure.
Similar with this, or is it something more like, okay, it's permanent, we're just going to be working on accommodating from here on out?
I would say it's similar. So you can, I think the factors that help us better, like have a better recovery, younger patients tend to recover a little bit better, and I think there's a lot of factors that lead into that. Like mainly, um, younger patients are going to have caregivers or families that are there to advocate for them like immediately when something happens,
Mm,
whereas maybe as adults we're less prone to go and get help like right away.
mhm,
That may be completely grossly not accurate, but that would be one of my assumptions, or at least based off of my lived experience.
mhm.
I'm less prone to go to the doctor if I'm feeling something a little bit different, whereas if my two daughters have a cold, we're like calling the doctor, right?
Yep.
So I think that there's that. So like youth helps sooner to diagnosis or sooner to getting like help or treatment, has favorable signs. So there was a study talking about functional seizures that if you are able to get treatment and care within like the first year, your recovery is substantially better than if you are waiting like longer than that. But unfortunately, the people are averaging like 3+ years to get diagnosed with functional seizures.
Mhm.
So that's where kind of getting those optimal recovery outcomes is hindered, if you will. But
Yeah.
recovery is 100% possible. But it looks different for everybody. So presentation can be very different for everyone. The different triggers and symptoms and like perpetuating factors are different for everybody. So care looks different for each person.
Mm. Which is challenging, but also cool as a therapist. You get to like tailor it to that person because it is so individualized and they need something specific that the other person does.
Yeah.
So it's
Well, and I think that that's another thing that's similar with concussions as well is if you don't have the treatment personalized to the life that you're helping them get back to, exercises are only going to be helpful to a point, right?
yeah.
Like in my recovery, we were working on returning back to work and doing transfer training and all these different like high impact, busy environment kind of situations, which if I wouldn't have done those things, I probably wouldn't be back working right now. Or maybe it
Mm.
would be a lot harder than it is.
Yeah. Yeah. Oh, it is so fascinating. The how individualized it is and the things that can be helpful. So how do you see, like what do you see OT's role, and maybe I know OT and PT are like hand in hand and we overlap in so many things, which is great. I love it so much. What do you see the difference between OT's role, PT's role, and how we can all help? And is speech often involved in this, or neuro rehab, like, or sorry,
It
visual rehab, visual therapy, or anything like that?
depends on the symptoms. So speech therapy 100% can be. So for, I know there's like speech impairment. Sometimes there's been research that's shown people coming with different like accents or changes in cognition and changes in like those kind of functioning. So that would be a role for like speech therapy. So 100% based off of the symptoms. Um, yeah, yeah,
Sorry,
it's
I'm
pretty,
like, okay, no, I met a lady who part of like her concussion experience, she all of a sudden had an accent and she was like, I can't, it was like not anything, not a place that she'd lived before. I don't remember where it was from, but it was like so bizarre to her and her whole family. Like everybody was like, what is going on? Are you making this up? I wonder if that
yeah.
related to this here. So
The
yeah,
brain is fascinating.
it is
It's
so fun.
oh my gosh, it's crazy.
It really
But
is.
no, to your question about occupational therapy's role or physical therapy's role, there are treatment recommendations that kind of outline what our roles are. But like the three main things that occupational therapy focuses on is education. So education on diagnosis, on treatment, on what OT does, and like symptom awareness, sensory integration, all those kind of things. The second one being functional task engagement. So personalizing, finding what are those occupations that are meaningful, and then building plans to re-engage in those. Part of the things that or tools that we utilize is like activity pacing, graded exposure, and then building in specific like routines. So nothing that our brain likes more than consistency and routine and kind of knowing what to expect. And so when we have this dysfunction that is constantly keeping us in this loop of not being aware of what the day is going to hold or what this next minute is going to be, routines can be something really like integral that occupational therapy can help with integrating. And within those, helping with utilization of these different coping skills, or we refer to them as self-management skills. Often these are nervous system regulation, sensory regulation, interoceptive awareness, utilizing sometimes utilizing biofeedback to get a better sense of kind of how our body is responding to physical activity or stressors or whatever it is, and then using that information to kind of build a personalized toolkit that we utilize during our occupational engagement and building our routines around to help us re-engage in those functional tasks. Physical therapy, there's a ton of crossover, right? So still utilizing the same nervous system sensory regulation strategies, interoceptive awareness, but still similar to what physical therapy would be working on anyways, is the motor retraining, functional balance, activity tolerance, all while utilizing like occupational engagement. And then approaches are teamed with psychologically focused treatment approaches. If we only treat the body, we're not going to get the progress that is necessary. And so we need a holistic approach that allows for engagement in processing and engagement in awareness of how our brain is operating and how our body is processing that information. And so we do it utilizing this like mind body holistic treatment of psychological and physical approaches is essential for FND. And I think that's one of the things that occupational therapy is so good at. Like we kind of do that intrinsically.
Yes.
So whenever I'm talking to other OTs about like treatment for FND, I try to hit on the fact that like you have all of the tools that are essential for caring for these individuals. It's the big twist is with many neurological disorders, we focus on the symptom. We focus on like this arm is impaired, so we're going to do electrical stimulation or whatever the intervention is, and focus on repetition, repetition, repetition. But with FND, the more that we focus on that impaired, whatever it's functional limb weakness or tremor or those sort of things, we're actually reinforcing that nervous system dysfunction. And so if we focus on the occupation or the task that we're doing, it redirects our nervous system, our attention from that affected limb or body part or whatever, and allows us to more naturally function, essentially kind of getting out of our body's way of our automatic functions to gradually improve symptoms and symptom management.
That is an interesting twist for sure. Of
Yeah,
like,
yeah.
and is that I feel like that would be challenging to do. I mean, how does that play out? Like, can you give us an example of what it looks like in a treatment with somebody if they are having a tremor while they're trying to accomplish a task? Like, what do you do with them?
First, finding out like what are the things that they engage in naturally, and what are the things that have been relaxing for them before. So, do they like music? Do they like to read? Or like, what are the relaxing tools that they already have in their arsenal? And then whatever the activity it is that we're doing. So, if we're trying to work on like a sitting task, often we'll notice like different postures or kind of leans to the side or offloading like weights and things like that. And so a lot of it is going to be initiating like even weight bearing or weight shifts, just doing repetitive movements that allow for us to stop focusing so much on the one symptom and engaging in just like allowing our body to kind of move. And so often when I start, I will see if I can get them sitting on the edge of the bed, and we'll just do some like rocks. We'll rock side to side. We'll rock heel toe. We'll do things even with like our hands if that's where the tremor is, just to get some different movements. We can, and the goal of that is also to get a sense of like, where's our mind in all this? Do we have tension in our body? Are there things that we can affect from like a posture standpoint to get us into a better like position to function? And then we work on environmental factors. So do we normally have the phone on? So kids are constantly on TikTok, or they're any kind of social media. So they're constantly in front of a screen and got the TV going in the background and have music going and probably in a really busy environment. So looking at, all right, we'll notice that these symptoms are more often present at like school and passing periods, or when the environment is pretty crazy. Let's see if we can maybe peel back some of those and get to like a normal, like a neutral starting place, and then slowly reintegrate these different stressors. And so whatever the task is that we'll do, we'll make sure that we allow for some sensory regulation, and then gradually increase that. So whether it's having like hall passing period sounds on your phone, just kind of like in the background, and they're engaging, they can be in a regular environment, but that's still kind of going there. So yeah, I think it's really just kind of getting a starting point, looking at posture, engaging in those functional tasks, and then utilizing these different sensory or nervous system regulation skills to help us retrain our body and let it know that it's safe and that we're able to function.
Yes, yes, I love that. And it's really amazing the things you can find on YouTube. Like, you can
Yes.
find hours worth of classes, like hallway noise or restaurant background noise or kids on a playground. I've utilized all of those. It is
Yeah.
so funny. Like, I don't know who puts them out there, but from all of us.
Thank you to whoever does that.
Yeah. So random, but so cool. And do you see good results for your with your patients? What kind of like timeline? How often are people like with seeing you for how long, and what kind of results do you see?
Yeah, so currently I work in acute care, and so we see them kind of at the very beginning when they're diagnosed. And so I can actually see some pretty good progress depending on like the symptoms and severity of presentation. Often with education, knowing what the next steps are, getting engaged with therapies and setting that all up, I can see some progress even just with that. And then we have an outpatient set up to where we can follow up and do more intensives. So I think the big goal with therapy is to make sure that we have all the key players that are essential. So working together, whether it's like neurology, psychology, OT, PT, and making sure that we're kind of like all on the same page. And often, it obviously this depends. So plan of care can vary, but often if we can get to recovery and engagement in therapies quicker, we're going to be able to see better results because we're going from that acute stage where we're getting the diagnosis, we're getting a plan, we transition straight to outpatient, we engage in therapies like that next week for however long, and then help them get back to their daily functioning. Like the goal is to get back to school. The goal is to get back to doing these things. So we want to limit the amount of time that we're away from that because those are parts, that is part of the recovery process, is reintegration into our daily activities. So the goal is not for these patients to be in therapy all the time or for a long time. And I think that's one thing that we historically have done with these patients. It's like, well, they still have symptoms, so we're just going to keep treating them until they're gone. And it's hard to translate recovery in a clinic to the real world. And so at some point, we have to reintegrate back into the real world and maybe have follow-ups and checkups and those sort of things to kind of help keep moving that progress forward.
Yes. So when they come in to acute care, that's like inpatient, that's like something,
Mhm.
it's a major thing and they are not able to be at home yet. Is that typically how it plays out? Like either
Uh, Usually they honestly, the way that it plays out is they come in because of either like functional limb weakness, the tremors, functional seizures, and they come in, they get diagnosed. Therapy sees them maybe a time or two, or at least this is what is going on at my hospital, and then they will discharge them home. So I think there's still the with the stigma around, we don't want to over medicalize, but we also want to make sure that we get them a plan and the care that they need to get them back home within their normal environment, within their day to day, because knowing that stressors can kind of trigger or exacerbate these symptoms, being in a hospital, having your vitals checked all the time, not getting good sleep, and having different like noises, and maybe you share a room with someone who's crying all night long, like that is going to perpetuate symptoms. And so if we're able to safely get them transitioned back home with a plan, that's the ultimate goal.
okay, yeah. And I assume that outpatient is part of that plan, like, and then follow-ups at home and stuff. So, or maybe not at home, but yeah, you're hearing how things are going.
Generally the goal is if they need ongoing therapies, it's to do outpatient, so they're not staying just at home. We're getting out in the community, and then another part of that discharge plan is school planning. So giving school letters to give them education, because even as therapists, we were never really trained on FND. So schools and teachers and principals are going to have no idea what to do with this. And so if you see someone not be able to use their legs all of a sudden, or having these seizures, they're going to call 911, or they're going to call families and have them taken out. And we want to make sure that we give the tools so that part doesn't happen, and that they can re-engage back into their like schoolwork.
Yeah, that's awesome. And I think that is a similarity too with concussion, like and I think people know a lot more about concussions or at least have heard about them
Yeah.
FND, but still there's a lot of education that needs to happen and a lot of support that can be given that would, yeah, allow the child to participate more and do the things versus just sending them home, or like if they're not doing well, sending them out. So,
Well, and to that point too, like it's interesting. Like I know that after concussion, like yeah, there's a period that like rest is appropriate, but like we want to re-engage in activity, and we want to like do that probably a lot quicker than we initially think. Even with my experience, they were trying to get me to rest and not do anything for a number of weeks.
what?
And I was like, I can't, like I but like thankfully for me, like I work with physical therapists and other people that help treat concussion, and so I have some of that information, but it's like yeah, it really is dependent, like, and it's dependent on where you go or who you see to the advice that you're going to get. And I think that that's another similarity with FND. Since there's no information or lack of knowledge, you're going to get someone that's like, just go home and stretch a little bit and you'll be fine. And it's like, that's not really helpful.
Yes. Yes. Well, and you also mentioned in kind of passing here, you said the stigma around it. Like, can you give us a little bit more information? Like, what are people dealing with who are on the stigma side? Like, what is that you're experiencing?
I think there's a lot of like medical gaslighting, a lot of actually providers telling these patients that they're faking it, or that they just need to stop being stressed out and they'll be better. A lot of the stigma is that this is brought on by the individual with FND, but it's actually couldn't be further from that. Like it's not of their control, and I would imagine that they probably wouldn't want to have this limb weakness or seizures, and would like to just continue with their day to day, right? So a lot of it is not like patient shaming, but it's like putting the blame on them. And I think that kind of goes back to the history of FND. Like it used to be known as like hysteria, and they transitioned it to like conversion. And so it was all of this, our thoughts becoming symptoms. And so if you stop thinking these thoughts, you won't have these symptoms. It's kind of what's going on. Often I'll even hear, I mean, man, this past week, I went and did an evaluation with a kiddo and was doing a chart review and seeing kind of what doctors have been telling them. And while they were having a functional seizure, apparently a doctor came in and just yelled, "Stop," to get them to stop. And while it helped them transition out of their functional seizure, I think they perpetually had like 6 more afterwards. And so it's like you can't replace a stressor with a stressor and think that that was a fix.
Right.
And I think that that's where a lot of the stigma is.
Oh, that's so interesting and so hard. And I can see how it would be so baffling and confusing for the patients and for their families.
Yeah, yeah. Because
Yeah,
if they're being told that this is in your head, then I guess we
yeah,
just figure that part out, right? And then
yeah,
often they're
right.
getting referred to, like, they'll get a referral to psychology or psychiatry, but not really told why.
Mhm.
And really, the big role with them is figuring out what are these triggers, are there stressors, and then let's find some self management strategies that are helpful for you, and giving them education. So there's a lot of crossover between the different providers
Yeah.
treating FND. And so there's a stigma even with like when it comes to referrals as well.
Interesting. And do a lot of the kiddos that you're working with also have, is psychology part of that team that's working with them?
Most of the time, yes. So if there are, I would say, yeah, like 75% of the time, we're going to get some sort of like psychological support or intervention, whether it's in the inpatient side or outpatient referral.
Hmm.
That's where, yeah, building that like team for these individuals is key.
Okay. Yeah. Yeah, I would imagine. And what, I know we kind of touched on this a little bit, but what school accommodations have you found to be particularly helpful for kids who are dealing with this?
Yeah, I think the main thing is getting back to in-person school. A lot of times I'll see that they're trying. Uh, there's an attempt to try to transition to homebound school, but then that leads to decreased activity, which leads to increased dysfunction, which leads to increased symptoms.
Hmm.
Um, and so, usual some accommodations can be like increased time for passing periods, maybe a shortened day, or we kind of like ease our way back in. So you go for like an hour or a half day, having the ability to go to the counselor or the nurse's office if we're having increased symptoms or we're feeling overstimulated or those sort of things. Increased time for tests, any of those sort of strategies, and then depending on the type of FND, having a different like response plan. Often we don't want to lead to like removal from school or calling 911 or those sort of things because that adds more focus on the symptoms, which then in turn increases the symptoms.
Hmm.
And so often things like functional seizures, we have a response plan, which lets us know like what does our functional seizure look like? What are our warning signs? Often it's these like interoceptive changes, like butterflies in our stomach or a headache or like an aura or out of body kind of like feeling, tachycardia, any of those sort of things. So these physical symptoms that we're having that are letting our body know that like, hey, something's wrong. Do something to help me calm down. And so then that's where kind of like psychology and occupational therapy or physical therapy come in because we can find these personalized self-management skills, nervous system regulation, sensory regulation, and
Hmm.
integrate those into the daily routine, times at school, identifying what are those stressors, and how do we build in proactive self-care.
And that's how that recovery happens, I assume, is you can get to a point where you're not having seizures anymore because you're recognizing ahead of time and able to calm the system well enough. Am I
Yeah,
assuming
yes, yes, you can. Yes.
Um, okay, and I guess I'm curious too, like what does it look like in a typical day? This is such an OT question, but like, and I know it depends on the person and what their symptoms are, but if like is it that sometimes in the day they'll be totally like normal kid, fine, like what they were 2 years ago, just like able to move, able to function, all the things, and then just like it'll hit and all of a sudden they can't walk anymore, or they'll be having a seizure, and then after that's over, they can get back. Like, is it within a day it's up and down, or is it like more consistent? Like I just for a week or something, I can't use my legs. Like what does it look like?
It
Sorry.
is different from person to person.
Okay, that's what
So
I was
you
afraid
can
of.
have um, the gamut of all of the examples that you just mentioned. So
Okay.
there are people that are like wheelchair bound right now that require the use of DME to get around and those sort of things. There are like ebb and flow of symptoms is very, very common. So example for me, when I go in to do an assessment for someone on the acute care side, um, they may not be exhibiting any symptoms when I go in there. And then I can leave and another therapy comes in an hour later, 15 minutes later, and they have increased symptoms. And it can be as quick as that, and it can be a lot longer, or it can be constant symptoms. But I think that that's also one of the challenges with it is when you walk in, you see someone who's completely quote unquote fine, you're going to kind of dismiss it and say, you're okay. Why don't you just go home and just get more rest, right?
Right. Yes.
And I think that that's where if we've identified that this is functional neurological disorder, it's really important that we provide the same kind of education and the same kind of support for when they are not immediately with us. And that's where like the personalization is so important.
Yeah, I could see that. And I can also see how it would be so challenging if you're going to come in and do an eval on someone because they can't walk and here they are walking around. You're like, well, wait a second. I like that. You just write your notes based on the history, like what they're telling you, and then trust that you'll see it later. Like, how does that play out?
Yeah, no, and I think the having the patient history is super important. Getting a sense of like how long have these symptoms been going on? Is there any kind of trend around them? Often there's not necessarily, especially initially. They're not, these families and patients aren't really looking for trends. They're looking for like, I just need to be able to move or whatever it is.
Yeah.
And so I think that that's when the symptoms aren't necessarily like in your face and present. Being aware that maybe there are some invisible symptoms that are going on. Like we're probably having changes in our routines that's causing us to not get as much sleep, which is making us more predisposed to having these symptoms. And so maybe we have a day that was really good because we had a good night's sleep. Not saying that sleep is the fix for all of it, but it helps with all of these different diagnoses.
Sleep is always helpful.
Yeah. Oh my gosh. I'm worthless if I don't get any sleep. But if we've had a good night's sleep, we didn't have a ton of extra activity or stressors the day before, maybe this day is actually pretty solid. And then we've done a lot more and we've gone out and we've engaged and we're around a lot of extra stimulation. And maybe that kind of excites our nervous system and kind of kicks us back a little bit. And so it gets us this like ebb and flow based off of the things that we're doing and just how our body is functioning.
Yeah, and that does sound very similar to the concussion thing. Like it can look like, wait a second, you were fine yesterday, now all of a sudden you can't function. Like what's going on? It does, like it may not present in the same way, but they're like, and that's I think the invisible part is like, yeah, you can't function, but if with a concussion, it's like mostly internal, whereas it sounds like with the functional neurological disorder, it may be more visible when it's kicking in. But either way, it's like hard to predict and really challenging. And yeah, I could see that.
And that's where just telling somebody, make sure you're pacing or take breaks isn't super helpful because each day is completely different. And I think the things that we do when we take breaks and when we pace are just as important as taking those breaks and pacing.
Yeah. Yes. Although they are important, but yes, it needs to be tailored and it needs to be a little bit more in depth than just like, yeah, take a break.
Just sit down.
Yeah, right. Can we talk for a second about nervous system? We've been mentioning it here. Nervous system, interoceptive awareness. How do these play into FND, and is there anything different between FND and concussions while as we're thinking about these things? I don't know if that makes sense.
There's plenty of things that are very different.
There's probably a lot, but maybe let's just start with what are they and how do they play into FND?
Yeah. I think both, it's important that we get a sense of what are the things that are overstimulating and what are the things that are understimulating for our nervous system or our sensory systems. And within like my treatment, I will go through like, especially like the sensory side, I'll go through the different sensory systems and we'll talk about like what are the things that are challenging, what are the things that are helpful, and then that helps us build our toolkit and awareness around like when do we use these.
Yes.
Same thing with nervous system. It's giving our nervous system an interoception. So often with FND, those, like I said, those interoceptive changes often are these like warning signs that our nervous system is working extra hard or having some difficulties. And
can you define interoception for our audience, just in case they're not familiar with that term?
Yeah. So it's like this internal sense of our body functioning, or like our automatic internal like functioning, like
Mhm.
um, heart rate and blood pressure and like all these things that we don't really focus on
Yeah,
happen.
internal cues.
Yeah, and thankfully we're like not having to like cue all those, and they just kind of automatically occur. And so we get these different senses um, of how our body feels different, and those are like increasing interoceptive awareness.
Mhm.
Often we don't individuals with FND have decreased interoceptive awareness, and so within therapies that can be one of the things that we work on is not hyper focusing on these different warning signs or symptoms, because the more that we focus on them, the more we perpetuate. But
Yes.
initially, having an awareness empowers them to know, oh, okay, this is what my body feels when X, Y, and Z is happening. So we kind of recognize these symptoms, and then we strategize what are the things that we can do to help. And so interoception and nervous system awareness and sensory regulation are really big keys that we can utilize in treatment.
Yes.
Um,
So important.
yeah,
And I
yeah,
do feel like that is very similar with concussion. And it does feel, I mean, I think dissociation is one of the things, people feel dissociated from their body. And sometimes if there's been a lot of pain, or there's a lot of symptoms and it's uncomfortable to be in your body, then it makes sense that you like try to like distance yourself from feeling inside your body. And yet
yeah.
and trying to find that balance of like, okay, I understand like to want to pull away, but also we do need to be aware of it, but we don't want to be focusing on it so much that it distracts us from everything else or like increases it. So it's just like, yeah, it's not an
It's
easy
it's not an easy
thing.
thing. Well, and that further emphasizes like the importance of having help from professionals that are
Yeah,
aware of these treatment approaches,
all of
right?
those.
So
Yes.
with currently, actually, functional seizures are actually called functional dissociative seizures. So, but not everyone who has functional seizures dissociates, and so we're really good at naming things.
We are.
Um, but yeah, exactly. I mean, it's a coping mechanism that our body does to keep it from experiencing these stresses.
Yes.
Um, yeah, it's
Yeah,
fascinating.
it is so fascinating. So and again, I know that every individual is different, but are
Sure,
there
sure, sure.
generally certain like generalized kind of tips, tricks, things that you have found to be generally helpful for people in calming the system, in like getting getting that positive kind of interoceptive awareness happening? What do you advise people to consider trying?
So the the first thing that people generally are telling these patients to do is to breathe, which I find more often than not just kind of like infuriates them because they're like, I am breathing. But I do education around like the importance of like purposeful breathing,
Mm,
and breath holding is pretty common in FND because we kind of just tense up and we don't realize it.
yep.
And so doing things like finger breathing, where we like breathe out as we go up and breathe in as we go down. And so it gives us a chance to not only do it 5 times, but also engage in some like tactile grounding. So we're
Mhm.
utilizing multiple senses that are allowing us to help regulate our nervous system.
Yeah. And sorry, I'm
Noting,
gonna throw out there. If people are just listening, he was tracing his hand with his other hand, like with his other finger. So that's finger breathing is just kind of going up and down each finger with the up breath. Up is what in breath, and then down is out breath.
mhm,
Is that generally how it works? So yeah, just want to make sure people
um,
listening could picture that. Keep
thank you
going.
for
Sorry.
clarifying.
No worries.
Or things like diaphragmatic breathing, which is the opposite of how we normally breathe,
Mhm.
which sometimes can be stressful for people. So trying those out and seeing what's helpful. Things like sour candies, it's hard to not focus on those. So utilizing things like that.
Mhm.
Or if you are like temperature sensitive, if you're sensitive to hot or sensitive to cold, maybe using the opposite to kind of help with regulating our nervous system.
Mhm.
I use a lot of like vagal nerve calming. So I think the more I use humor a lot, or at least I perceive that it's humor. And so, like laughter, humming, singing out loud, all of those things help relax our vagal nerve, which helps bring our blood pressure, heart rate down,
Mhm.
helps our gut relax a little bit. So, any of these things can be options that we try. We'll use like aromatherapy, or if they have a certain sense that they like, they can ground their focus on that.
Mhm.
And so we kind of go through like all the different senses and see what's helpful. Proprioceptive awareness, sometimes using like weighted shoulder like vests or blankets or those sort of things are beneficial and helpful. So we kind of
So
explore it and see what is most beneficial for them.
I love that. Thank you. And I guess that is similar to, I think a lot of like similar to concussion stuff as well, as far as just like what we want to use the nervous system or the sensory system to help access and like calm things down.
Yes.
So yeah, those are great. Um,
And I
any,
think that,
oh, go
oh,
ahead.
sorry to interrupt. I think that that's where another key place where occupational therapy can come in when it comes to treatment. There's really not a lot of research that has been done that has shown the benefits of occupational therapy. But whenever occupational therapy is mentioned within a research article or study, it's generally of like quality and benefit.
Mm.
And so I think that that's one of the needs that we have is more awareness of like what we can bring to the table and how is that helpful.
Yeah. I think that makes a lot of sense to me that yeah, we have a lot to offer there. And I think also on that on the concussion side too, this like neurological conditions, that sensory awareness really does impact everything. And so having somebody who's really conscious of and aware of and able to come up with strategies and grading and all of those things will be very helpful in
Yeah.
that recovery process. So I feel you on that. uh, what advice do you have for the caregivers? So the loved ones, the parents, the people who are like watching their person suffer. It's baffling and confusing and so hard. What do you tell them?
Yeah. Um, First, I let them know that this is real, and that they are not putting it on, which seems like something we shouldn't have to tell because it's very obvious, but it is real. And then I would stress, especially within like youth and young adults, the benefit of co-regulation. So often, while I am working through and finding what are the strategies that are helpful for my patients to help their nervous system regulate, I'll have the caregivers practice it as well, because often when we're having this increased symptoms, caregivers are going to get more tense and it might not be the most helpful thing to
Mhm.
have around. So having them practice strategies that can be beneficial from a regulation standpoint is really helpful, but also it shows their child or whoever they're caring for um, that these are options of things that they can try.
Mm,
I'll also do the same kind of education with them that I will with my patient to make sure their understanding of the diagnosis is consistent. And then
mm,
same thing around like response plans. How do we respond in the middle of it during a functional seizure? We're not doing sternal rubs. We're not yelling at them and asking like, "Are you okay? Are you okay?" Because that's making a more stressful event more stressful because you're increasing maybe potential anxiety in the environment. So regulate ourselves, let people know that they're safe, help them utilize these different strategies, and kind of be a tool for that um,
mm.
progression. Yeah.
I love love it so much. And you actually like the way that you phrase this, it's so interesting. A lot of those are similar to instructions or like recommendations that I hear a lot for people, caregivers of someone with a concussion. Not as much on the don't sternal rub when they're having a functional seizure. That's not usually what I hear, but
Yeah.
it is real, even though it is sometimes baffling and it is like and then also I love the way that you said it, the benefits of co-regulation, because a lot of times people will say it's important for the caregiver to take care of themselves. Like you need to get your needs met as well. Like you need to take care of you and relax, get take care of you. Um,
Yeah.
but I hadn't really made that connection as far as the specific, like, not only is it good for you and you need that and they need you to be functioning, but also you like co-regulate. You show them that example and your regulation is going to be able to help with theirs. And that is really powerful. Like connection, healing happens in connection, and that co-regulation is key. It can be a huge help along the recovery path. So I
Yes.
love that connection you made there for me. So thank you for that.
Of course. Well, I
It's
think that's one of the upsides of having a caregiver that's present. That they have someone that's right there that you can kind of educate.
yeah.
Obviously, as we age, we maybe don't have someone that's right there, and so for like youth and young adults, like the caregiver or family are like tools that they could have in their toolbox that can be of benefit. But also I find that like if I don't give something for the caregivers to be able to do, they are more lost or more anxious or whatever. And I was like, as a parent myself, if I didn't have a job that I could do for my daughters, if they weren't feeling great, like that would make me feel like kind of helpless and kind of hopeless with that. And so I find that being beneficial for recovery.
That is super interesting. And yes, your job is to regulate yourself, like take care of
Yeah.
you so that then you can be, like, and it's not just like, oh yeah, then you can be there for them, but like literally you are making a difference for them in their recovery by your being regulated. So it's cool. And I'm just curious, side note, what should people do if somebody's having a functional seizure? What is the recommendation? Like instead of asking them if they're okay over and over again, like what is the procedure? What do you guys recommend?
So I think the first thing is get them into a safe position. So if they are able to sit in a chair, let's sit in a chair. If they need to lay down, then have them lay down. So have them in a safe position where their head is safe, because there may be big movements that could cause like injury. And then I think the goal is to, as the caregiver or whoever is there, is one, remain calm, let them know that they're having a functional seizure, and then if they're able to, we help them utilize some self-management strategies if it is appropriate. If they are in the midst of a functional seizure and they're having big movements, that's not the time to be like, do your paced breathing, right? Like that's not going to be super helpful. But then I think the next role would be making sure that we regulate the environment. Are there a lot of people that are kind of around and hovering and making a lot of noise? How do we kind of separate so we can allow for a more environment or a more calm environment that allows for re-engagement? And I think one of the differences with functional seizures is sometimes they can last a really long time. One of the positive signs is like longer than 5 minutes. And so some of them are 30 minutes, 45 minutes, an hour. I mean, they can be really, really long times. And so if you are in an environment that is really overstimulating, you're constantly overstimulating the nervous system. So it's safe position, reassuring that they're okay, utilizing some of these self-management strategies when they can, if they can, and then ensuring that the environment is safe and calmer. And then once we transition out of our functional seizure, the goal is to gradually help them get back to engaging in their activity. So whereas for epileptic seizures, they may be extremely tired, or that like post-ictal period is a longer time for recovery, it may not be the exact same for functional seizures. You may still have fatigue, you may still hurt, you may still have these different things, but the goal is to gradually re-engage in those activities, because in doing that, you're helping with rewiring or re-educating the nervous system that this dysfunction, you are still safe and you can still function. And this is the way that we do that.
Oh, that's so fascinating. And that does make sense. And I imagine, do you have to do a lot of education do they get occupational therapy services at school as well? Like, are they getting help that way? And are those therapists educated on this? Just curious.
They're not often. I would say if rarely are getting like the occupational therapy at school. So a lot of times the education is given to like nursing or administration or counselors or those groups. And more often than not, the nurses at school are the ones that are leading the main role of being able to help with utilizing these strategies. From are they trained? I would say no. That's where we get a lot of not kickback, but we get a lot of resistance of utilizing these strategies because they're so different than what you would do from something that looks the exact same. And so that's where I think a lot of like within the FND Society and all these different groups, we're trying to do a lot more education around like the why behind, and also empowering healthcare providers to know like how do we open conversations with schools and not have it be like a drop off and say good luck. Like this is a collaboration. We're still working. Let's work together to help them improve, or work settings or those sort of things. So yeah, a lot more education.
A lot of education that needs to be out there, and that's another similarity with concussion. So
Yes.
why this podcast is happening. Okay, excellent. Well, I know we are like out of time, which is so sad because I like could really talk to you all day. But really quickly, if you wouldn't mind just sharing any any thoughts on hope for that you like hope, speak to hope for a second. Because I know it can be a tricky thing sometimes. So how do you see hope with this population, and what kind of advice do you have for people in relation to that?
Yeah, I think from a hope standpoint, that there is hope for progress, and making small changes and implementing small, frequent strategies can make really big, lasting changes in our symptoms and ability to engage in these daily occupations. Um, and that I would say that you don't have to do this alone. Like recovery for most, if not all, diagnosis disorders is going to be more optimized when you do it with your social like network or your caregivers or your support system. And so ensure that you kind of you're working with your tight social unit, and that there are organizations that are out there that have support groups and information that you can access to ask questions and see if like what is going on with me. Is this the only? Am I the only person that has this going on? I can probably bet that you are not, but finding somebody that you can kind of talk with can be beneficial. And then I think though finding providers that are FND aware is really, really hard. There are therapists out there that are doing a lot of work to progress this, and that therapists can be beneficial for recovery. There is hope. And I think that it takes little actions repeatedly to kind of keep making progress.
Yeah, thank you for that. It is just reassuring to know that there are things that can be done, and that there are people who understand it and who know what to do to help. So finding that, and again, similar to concussion, it's like finding someone who knows this diagnosis specifically makes a huge difference, and it's hard to find them. So we recognize that, but it is possible.
Yeah.
It's out there, and you are leading the charge in helping with this, which I love. So why don't you tell us what resources you like to point people to, and what you're doing, and how people can get more from you if they want to hear more.
Yeah. I hope they want to hear more. That would be awesome. Usually the starting place is if you've just been diagnosed with FND, or you're just trying to figure out like what is going on. A website called neurosymptoms.org is kind of the holy grail of FND resources. And it's written by and collaborated by leading providers in the FND world. So really, really great resource there. There are actually, I wouldn't say a ton. There are a number of patient-led advocacy groups like FND Hope, FND What Now, FND Action, all around the world that are ready to help and connect and integrate you into the FND community. So reaching out to them. That's one of the things that's been interesting about FND, is that providers are very open to sharing resources and collaborating. And it's not like I want my institution to make progress over yours. They're all kind of working together as one to make progress. Slow, but progress nonetheless. And then shameless plug for my website, rewireot.com. It is was intended to be kind of a melting pot of all of these resources in one, where you can go and have links to other organizations or other support groups or things like that. There's publications on there. And then I am opening a clinic very, very soon, which is super exciting, to where I can start providing therapy on an outpatient basis, both in person and through telemedicine, to kind of meet people where they are. So yeah, a lot of things going on.
I love that so much. I really do love that. And I'm so glad that you're providing this for people, and imagine that you will have people coming to you from all over, which is good. So good that you're providing this for people. Thank you so much for coming on and sharing all of this. You've opened my eyes to a lot of things that I did not realize. So thank you. Thanks for the good work you're doing. Appreciate it.
Likewise. Thank you.
I'm so glad you listened in today. I hope you have gained some helpful insights and inspiration regarding dealing with and recovering from concussions. My goal is to create more awareness and education about concussions and the fact that there is so much that can be done to improve life after someone has had one. Help me spread the message by liking, commenting, rating, and subscribing to this podcast, and share it with others who would benefit from hearing it. There are more resources available on my website. And again, if you or someone you love would benefit from concussion coaching, sign up for a free consultation using the link in the show notes or at my website, www.theconcussioncoach.com. Thank you. See you next time, and take good care of that amazing brain of yours.